feel what that feels like. So you do a lot of recycle, or at least you used to take stuff to recycle?
Every week, so Kent, we have recycle.
Yeah, that seems to be my job at home too. Everybody throws stuff kind of toward the recycle bin in the garage, and then it's my job to actually get it all the way in the bin and then haul it over to, I live in Silver Lake,
Oh, okay.
so I don't live too far. And there's some, right on Bailey Road, there's some places to put the recycle in, so I take over there too. That seems to be my job. So I'm just seeing where your shoulder blades sit and the position that they're in. All right. Show me, and I'm just gonna keep my hand on your shoulder blade. Show me how far up you can lift your arm on its own. Like that. All right. Show me how far in front of you can lift it. That's the hard one, huh?
Yeah.
Yeah, okay. All right. Show me how far back you can bring your arm toward me. Yeah, okay. All right. Now, if your arm's just there, how much can you, without moving the upper part of your arm, how much can you straighten up your elbow as if you were going to put your hand on the edge of the mat here? How much can you do it totally on your own without using your left hand to help? That's hard. That's hard. Okay. All right. Now, show me how far you can turn to the left, your whole body. And show me how far you can turn to the right. Not bad, huh? You can do that pretty well.
We worked pretty hard on it.
Yeah, you can do that pretty well.
Each day.
Okay, all right. Show me how quickly you can turn to the left and then to the right. All right. That's not bad at all. That's really nice. All right. If you, as you're sitting there, and I think there's enough space to do this, lean down on this elbow, yeah, and then sit back up. Now, can you do it on that side? That's not bad, huh? Good. Can you, with your left hand, reach down to your right shoe? All right, now can you do the opposite? Or just as far as you can, do what you can. Just show me how much movement you have. As you're moving that way, obviously we see how hard it is for your arm to do it, but do you feel it in your back too, or do you not feel there's a restriction in the movement
No,
of
mostly
your body? It's
the most, I hate the tone,
Mhm.
and then when I get nervous and just, everything just freezes up.
Because you've got some nice movement through your body here, and it seems to that most of the difficulty is in the arm. So a lot of times when people have one side that is difficult to move, it also impairs how much they're able to move your body and your trunk. But you move that pretty well and pretty evenly.
Yeah, you know, each day, because my shoulder was starting to move
Forward.
and
We do a PNF stretch. So go ahead, turn to the, that's good, now that's how far it goes, now do,
Not bad at all.
now do this side.
Does your shoulder ever hurt?
You ready?
Oh.
5 seconds.
Not anymore.
Push, push, push. Okay, good. We'll get
And
past
then
90.
go the other way too.
Push, push.
Now, if you don't mind, I'm gonna watch you one more time, but I'm gonna watch you from behind. So if you'll go to each side again, one more time.
This is amazing. I do that with my friends, but now we have a weighted bar.
Okay.
I used
You
to.
can go all the way to the right again if you can. Just turn and, Mike, let him go all the way. Yeah, let me look. Okay. All right, and then turn all the way the other way. Okay. Yeah, that's what I wanted to see. All right, thanks. All right, so I'll let you get out of that Houdini hold. And have you sit down. All right. No pain here? No. And nothing has ever, you said not anymore. Did
Oh,
it used to?
I took a couple of falls
Oh,
on the shoulder and
That's not gonna loosen that shoulder up well.
No, okay, yeah, it just, the last year, I figured it was.
Got
a
it
little bit-
predicted,
Yeah,
so that,
fraction.
well,
I fell out of the shower at the hotel.
that wasn't good, huh? That can't be good. All right. Mike, I'm gonna ask you to sit on the floor right here in front of Charlie.
Do you want me to turn this?
Either way, it doesn't matter. And if you'll go ahead and just put your feet flat on the floor. Yeah, like that, all right. Now, I want you to turn as much as you can to the left. All right. And what I want you to do is think about and try, we won't even involve your arm yet, taking your body and laying it down across your left thigh. Can you do that? Yeah. And go as far as you can. And you let me know if you don't like how that makes you breathe or, no. I mean, I don't want you to get down there and then you can't breathe. And I'm gonna have you turn all the way you can again to the same side, to the left. And then lay as far as you can down across your thigh. While still breathing. Breathing is good. I like people who breathe. All right. If you can stay there, I would like that. If you get uncomfortable, and you can take this arm if you want and grip onto the side, or, you know, however you want to do that. What I'm interested in is getting some length of your musculature along this side. Okay.
and we're right the rest.
Right between the ribcage and the pelvis. Now, if you can stay there, are you comfortable enough to stay there? All right. Let me have this arm while you're there. And reach out toward Mike as far as you can. Now, I'm not going to have Mike pull your arm, but just kind of support it here. You okay? Now, there's nothing I need to do to hurt you or to stretch you so far that it's uncomfortable. There's just no reason for me to do that. So when if I get to a place where you think, ow, just tell me to back off a little bit and I will.
Okay.
All right. All right, I want to see, can you turn even a little bit more? There you go. And is there any more give? There you go. Latissimus stretch. It's my favorite. All the joints that latissimus crosses. There you go. All right, we still okay?
Now, is this where we can do that?
Yeah, you can do some cross fiber massage, you can do some vibration. Not bothering your shoulder?
No, not so
No?
far.
Okay. Like I said, there's nothing I need to do to make anything hurt. Except maybe just to feel a little bit of a stretch. That's all I'm interested in getting.
Yeah.
You want it
Alright.
stretched?
Oh, yeah. Right where her hand.
Right here?
was. Yeah. I
Good.
love it.
That's what I want.
That's just where it's
That's
supposed to be.
just where it's
Just
supposed to be.
Because that latissimus is such a big extender. And if it's tight, how do you get the length?
Okay, still doing okay, Charlie?
Mhm.
A little more here. That's good. Keep with me if you can. We'll stay here for a while. Boy, this is easier than treating children. I treat children quite a
Oh.
bit, yeah, that's my,
Keep breathing.
I'll tell ya. I can get some kids to do this for a long time, but boy, you have to entertain them a lot. And this is what I'm after in them a lot of times too, but they don't wanna stay here so long. Okay, doing okay? All
I
right.
can't wait to go to my golf lesson.
See, what I'm worried about is that I'll mess up your golf lesson.
Oh,
You know?
oh.
All right, come back on up. I'm worried that if I work on things and change things, then I'll mess you up. It could happen.
We'll fix the golf.
I would. Put your arm on top. All right. Now, Mike, if you will, as we work here, if you will help Harlan just as much as you can, push that arm down against the ball. And you do it, Charlie, as much as you can. I won't call that isometrics because that's a bad word in your vocabulary.
Any pain?
Yeah, it
You're
feels
okay.
like it wants to crack.
Oh, yeah. You okay? And if you could just, and it doesn't have to be a hard push, just a gentle push, whatever you can do to push your arm down against that ball. That's it.
Went to the peanut gallery, what you doing now? Why is she doing that? What's going on?
It will make them, will make them, push
Anybody?
Proprioception of the ball.
And?
what else?
Rotation.
Now, let's take the, we don't have a lot of room, but push the ball out, keep your arm just where it's at. Don't move the arm. But see if with your whole body and your arm, you can push the ball out to the side. And then bring
He's
it
doing
back
something
in.
actively, right?
And
Try
push
to
the ball
relax.
back out.
Contract,
And
relax.
come back in. Yeah, let's keep doing that a little bit. Let's keep that moving. Bring it back. What?
That's, it finally popped.
Oh, okay. I didn't feel it, but I'm glad that relief was there. And bring it back in. All right, now let's go out and stay there. Can you stay there? Are you all right to stay there? Yeah. All right. That would be really nice.
Rotation of movement. I see the vibration.
Mhm.
Is that me?
No, that's me.
No, it's Marcia.
It's me doing it on purpose.
Is that mobilization of movement?
Well, and vibration, manual vibration is at a very low frequency, and it often helps people stop contracting or stop holding their movement. Well, just popping. All right, now, just go ahead and sit yourself back up. And from where your arm is, just gently push down on the ball. And hold it, that's fine, yeah, that's fine, just push down on the ball. Push down on the ball. I want space between his arm and his trunk. I want some space there first. I want the shoulder to come more in depth. Lateral rotation, out of elevation, internal rotation.
You won't be able to see it. I can't see it.
No.
All right. Now, go ahead and sit yourself back up straight. We're gonna take this ball out. And you can put this ball in between your arm and your trunk, like that. And just a gentle, not a hard, but just a gentle squeeze. All right. Now let go of it a minute. I don't know yet, I might need that ball back, but I'm not sure. No, it's- I want more, what I want is more external rotation. What Marcia wants. we go. Now give it a gentle squeeze again. Just gentle, doesn't have to be hard. That's it. All right, and stop. Put that orange ball back underneath it, even with this purple ball there. I'm gonna stick this. Yeah, maybe. That is small, isn't it?
No, that's not an exaggeration.
That's-
What are you feeling, Tanisha?
Nothing, that's right, I keep looking, because I'm thinking that I should be really tight.
your arm by now?
Now, push down just gently. Nice. And now squeeze that purple ball in towards you. Okay, not with this part of your arm. That's what your arm wants to do, but with this part of your arm. And let go of that. A gentle push against the green ball. And then with your upper arm, a squeeze against the purple ball. And your lower arm wants to do all the work,
Yeah,
and I won't fight with it. There you go, there you go, there you go. And let go of that.
So you want his last squeezing it and
I want to get frontal plane abduction with as much external rotation of his shoulder as I can get. Instead of elevation, turning in and holding this, I want this arm to come down and then hold in this way. Right there, just push down on that ball. There you go.
Better.
Yep. We won't call it isometric. Right, Charlie? I never heard anyone that thought that was a bad word. But if someone put me in a straitjacket, I'd probably say too,